Welcome to For the Health of It, an intimate look at public health in Cowley County, Kansas. Join us as we discuss topics that are impacting public health in our community and learn about what we do at your local health department. Hello once again, everybody, and welcome to another edition of For the Health of It, Cowley County. This is Tom Langer from the Health Department, and along with me today is Allie Payne. Allie, how are you this afternoon?
I'm well, thank you.
Behind the mic, you don't see him, but trust me, it wouldn't happen if he wasn't here. We've got Daniel with us, as always, taking notes and trying to not wince too badly when I make mistakes in my delivery. And today, in our podcast room, we have a special guest, and that is John Costello. Hello, John.
How you doing, Tom?
How are you, man?
I'm good.
Glad you could come out and join us today on this hot summer day.
Yeah.
Hey, today we're going to talk about something that's near and dear to your heart, right?
Correct.
And I'm not going to even try to explain it. I'm going to turn it over to you. I know that we met at the Health and Safety Fair.
Yep.
And when I saw your table, I looked at it and I said, oh, you've got to come talk to us about this. And you are connected to a program that's called Retainworks.
Yes.
Right?
So Retainworks, we're a no-cost grant-funded program focused on helping people get back to work after an injury or an illness or an exacerbation of an existing condition. We are funded by the Office of Disability Employment Policy, and they wanted to take a look and see what could be done with individuals that are missing work because of that injury, illness, exacerbation. Kansas is one of 5 states to receive this grant. So Kansas, Minnesota, Kentucky, Ohio, and Vermont are all participating in kind of their own little market, so to speak.
Is this like a pilot program, or?
It's a pilot grant. So when we first started in 2018, we piloted it in Kansas, and phase 1 was just in Butler County.
Okay.
And then phase 2 came around, and we were able to kind of increase that coverage statewide. So we work with various medical partners throughout the state. So Ascension Via Christi, Stormont Vale up in the Topeka area, KU Medical Center up in the Kansas City Metro, and then KU Med kind of also goes out into kind of some of the western parts. Some of the western parts of Kansas. So we were able to kind of increase that footprint in order to get individuals back to work.
Tell us a little bit about it. So, I understand the concept. Somebody gets hurt. So it could be a work injury. It could be a non-work related injury, right?
Right. Either one.
Accidental, whatever. Tell us a little bit about what happens, what a person goes through, how they get connected, and all that good stuff.
So an individual has an illness, has an exacerbation of existing conditions. So you're out playing soccer one afternoon with your kids and you tweak your ankle. Oh, it's fine, no big deal. You wrap it up, and a month later it's still hurting. So you go in and have the doctor look at it, and they're like, you broke it. So now you're going to need surgery. So that's, it's an existing condition. So it goes. So from there, obviously the individual's going to go to their employer and be like, hey, I'm going to be out of work for X amount of time because I've got to have surgery. It's however long recovery period. So they would reach out to Retainworks through the website, which is www.retainworks.org. They would fill out a quick form, name, date of injury, a little bit of information, are you working, etc. And you would then go through an enrollment process with one of our nurse staff. From there, the individual is assigned a nurse navigator, and that nurse navigator will start the initial process. So they will go through and they'll go a little bit more in-depth health-wise with a questionnaire. So are you working? What do you need in order to get back to work? So your employer might have said, hey, you know what, you can probably come back and do light duty or something like that. So we would then work with the individual, their medical provider, and also the employer to kind of figure out that what's the best solution. Can this individual go back to work still doing their same job light restrictions? Do we need to move some job duties around? The other option would be, can you as an employer train this individual to do something else, to do another job? When I go talk to HR folks, I'm always saying, hey, look at some of these harder to fill roles that you can't fill because of whatever reason. Go in, take a look at that, and maybe this individual might be a good fit. So training, accommodations, or even support services.
I'm looking at your brochure, and it talks a lot about certain things which helps provide some information. But what's caught my eye is the fact that this could be, like you say, anything that's due to a recent accident or injury, right?
Correct.
Or I think the exacerbation of a chronic condition. And to me, that's something that I think probably is interesting for folks that might have COPD. It has that in there. A lot of other conditions that we know about, like heart failure, I would imagine asthma.
Asthma.
Anything that would limit the way a person could function in their job setting.
Yep,
right?
Exactly.
So here there are some conditions as far as who could qualify. Can you go over those?
Yeah, sure. To qualify for Retainworks, the injury or illness or exacerbation has to have happened within the last 12 weeks. They have found through various studies that once an individual is missing work within 12 weeks, it's pretty much a coin flip on whether or not they're going to go back. So we're trying to get ahead. We're trying to get ahead of it, kind of a holistic approach to it within that 12 weeks. So injury or illness within the last 12 weeks between the ages of 18 and 65. They have to live or work in the state of Kansas. So especially down here, if you have individuals that live in Cowley County, but go to, say, Ponca City to work, or if they're working in Ponca City, or if you have individuals that live in Ponca City or drive up here to go to work at, say, Creekstone, then those individuals are eligible for this program. And then also not on Social Security, disability income, or any of that.
Yeah, and the ages between 18 and 65.
Yes.
So how does this work, or how does it function with other programs like FLMA or things like that an employer may be subject to in the state?
Right. So the employers are subject to those, obviously, from the Department of Labor, but this works in conjunction with it. So you can have an individual that is out of work because of the injury or illness, and you can have them on light duty. After that, say that FMLA runs out, you can bring those individuals back on a light duty piece or an accommodation, or again, retraining to find a different job.
Okay. And so that's really what this amounts to, is trying to help navigate that process for finding the reasonable accommodation.
Right. Finding the reasonable accommodation, just thinking outside the box. How do I keep this individual employed? How do I keep them here in the community? How do we keep that homogenous relationship with keeping this individual employed? Because most of the time, if someone is out on a short-term or long-term disability claim, they're looking at least a 40 to 60% pay cut right off the top. So that's kind of where our support services piece comes in with that, is that we can help cover some of those things like rent or a mortgage to kind of be a stopgap measure.
What industries have you seen that maybe benefit the most, or that you guys have interacted with? I could imagine that, like in warehousing or construction or contracting, where it's really physical work, and if a person gets injured, that may take that ability for them to work entirely away.
Yep.
Because you no longer can lift, or you can't drive a tractor or a forklift or whatever it might be. I'm just kind of thinking it through. But talk to us a little bit about some of the industries you may have already interacted with.
most of our injuries have come from either the medical field or the manufacturing field.
Really?
So one of the things that we do look at with our medical providers is we look at them as both providers. Hey, I had a patient come in and these patients could qualify for Retainworks. Oh, I had a nurse that threw their back out because they were lifting a patient. Or I have a nurse that's out because something happened over the weekend and they are not able to go back to work in this particular environment.
Interesting. So, speaking as an employer, I know how difficult it can be. And sometimes you can't. I mean, there are no accommodations in some cases. But you hate to see a person lose their livelihood or their income.
Right. So we would work with you as the employer to say, okay, what is this individual able to do? Let's look at their activity prescription. So we would look with the nurse navigator and the employer and the individual, we would all look at the activity prescription and say, okay, what can we do? And we would then go to you as the employer and say, hey, what can we do with this individual? Can we move some of these job duties around? Can you maybe put them at a front desk position for a while? Are you short coders? Could we train this person? We can reimburse you for some training dollars for this individual to maybe start coding, be it CPC or an ICD.
The interesting thing, I'm thinking now with the employee hat on. Anytime something occurs that changes their life. I mean, the situation you mentioned, the guy's out and he's playing ball with his kids and trips, and all of a sudden, what he thinks is a minor injury becomes a major medical expense, like you say, many weeks or maybe even months of disability. In some of those situations, I know they may lose their jobs because of that.
Right.
I would imagine that the mental anguish and everything else that goes into a scenario like that has to be overwhelming.
Yeah.
So what can you do for those individuals that maybe are experiencing something like that?
So that's another one of the pieces that we worked on through this program is developing mental health type stuff. So rates of anxiety and depression are typically 3 to 5 times higher for those that are on long-term disability. So an individual may be okay physically, but they're not ready to go back mentally because of PTSD. We've had some webinars that we've gone through that talk about individuals that, yes, they do have PTSD because of this major medical issue, because of cancer or anything like that. So, and that's one of the pieces that the nurse navigators are really honed in on is the mental health aspect. Yeah, I'm physically ready to go back to work. I mentally want to go back to work, but way back in that corner of my head, I'm not really that ready. So that's one of the pieces that our nurse navigators have really honed in on.
Do you come across any scenarios where people develop dependencies? I think about recent history when people would be hurt and they would be prescribed pain medication, or they would self-medicate, alcohol, drugs, whatever it might be. I mean, have you run into those types of scenarios?
We have, and we've been able to help a couple individuals find better employment because of that. So we had an individual that she was working in a warehouse facility, and she got a new job, and she was living in a sober living house. And they were able to get new employment, making about $7.50 more an hour.
That's good.
Which is good money.
Okay, we dove right into everything, and John, we didn't really get into the background of who you are as a person and your background. Why don't you tell the audience a little bit
Sure.
about who you are, where you're from, and and what uniquely qualifies you in this area.
Okay. So my name is John Costello, and I am I'm with the Workforce Alliance of South Central Kansas. So we are the workforce center, both here in Sumner and Cowley County. And I have been doing outreach for the Retainworks grant this is my third year in this grant. So I started in January of 23. So, and I go out and I do outreach and I tell people about this grant. So it's a fantastic program. It's really kind of something that's kind of close. I had a major medical issue in 2022, and it's just like this program is perfect, and so I think that lets me be somewhat qualified to talk about it.
Kind of first person experience.
Yeah,
with
exactly.
It. Yeah.
So because I walked back into the office. It happened on a Thursday, and I was back in the office on Tuesday because we were closed on Monday. And I was like, I'm ready to go. And they're like, no. So they're like, you've got to go do some stuff. So, I mean, that really made it that much better because it's like I can understand what the individuals are going through. If I had not been able to go back to work and do what I do, I would have gone absolutely nuts. I'm not a work from home person.
I think a lot of people are that. I think we tie our identities up so much in the work that we do.
Yeah.
That if you take one of those components away,
we
don't know how to act.
Yeah.
We don't know how to react. And Allie, I've been talking a lot as I always do. You got to have some questions.
Okay, so I'm looking at the Retainworks website, and my eye is immediately caught by a tagline that's on here that says, "Work is a health outcome."
Yes.
Love it. Can you just expand on that just a little bit more? I think it relates well to what we were just talking about with mental health.
If, again, it's with work as a health outcome, that's what we want. We want to see individuals go back to work. I don't know if trope is necessarily the right word, but it's a common theme that people are like, oh, well, nobody wants to work. I've been asked that by politicians, and it's like, well, what's the point? It's like, well, individuals have bills to pay. They have dynamics in their household, in their relationships with individuals, with the community. And if you take that work piece away, you're going to have a lot of individuals just kind of out there trying to figure things out. With work being the health outcome, hey, I want, as an organization, as a grant, I want to be able to get you both physically better and mentally better to go back to work because you want to go to work. Actively seeking employment, that's another one of our things with the qualifications, is that if you don't have a job right now and something happens, you're still eligible for this program if you come in and say, hey, I want to go back to work, and my illness or my injury is preventing that. So that's definitely one of those things that people have bills to pay.
Yes.
The electric company, the gas company, the cable company, the cell phone company, they don't care that you've had an injury or that you've been out of work for, 6 weeks because you messed your shoulder up. That's just how it is. It's a business. So we want to be able to provide that health outcome of being able to go back to work, because it adds to that, not really ego boost, but it adds to that, your inside, your own personal, like, yeah, I'm going to work.
Right. Yeah, I really like that. And in public health, we oftentimes talk about the social determinants of health.
Yes.
And one of them being economic stability. And I know just here at the health department with our own employees, one of our benefits is our health insurance.
Yeah.
So it's just interesting how all those things tie together and really can impact health.
Because if you don't have, with all of your social determinants of health, if you don't have that financial stability, then you can't move up to the next rung. If you don't have that financial stability, well, what's the first thing that's gonna go? Is it gonna be your health? Because, well, I'm gonna skip lunch today because I can't afford it. So then your health starts to drop, and then you're in an endless cycle.
I could imagine that the anxiety. You have maybe a single parent household, and that job is everything because it puts the food on the table, like I say, it keeps the lights on, all of those things. And in today's world, there's not a whole lot of people that have a great deal of savings or extra means that they could
live on.
Yeah,
Right, exactly.
they could even survive a 6, 8, 12 week rehabilitation.
Yeah.
Where
And
they're not
it's-
working.
And in my own experience, I was out of work for a month, and we were okay because my spouse works. But if I was a one-income household, or if I was a single parent, what am I going to do for the month?
Exactly.
You know?
How are you gonna cope? And,
Yeah.
I would imagine if you're hurt and you can't do it, and you've got kids or whatever to take care of,
Yeah.
that capacity is diminished greatly. So, if you were to be talking to the general public and you tell, hey, when is the time that they should sit there and say, I need help? Because I would imagine most people are slow to that point. No, I can do it. I'm fine. I'm going to be okay. But they're not,
Yeah.
We think we can shoulder it and carry it, and then all of a sudden it's too late,
Yeah.
and we're crumbling. So, I mean, John, really, when you do outreach to individuals, just if this happens to you, what should they do? What's the process they should follow?
Just reach out to
them.
Yeah, reach out to Retainworks. So if an injury or an illness or something like that happens, first call should be, obviously your medical provider, but look into Retainworks. We hear a lot of people that are like, oh, well, I could have used this 5 years ago when I blew my shoulder up. I could have used this, 3 years ago when I got hurt at work because of my back. But with the current situation, if there's an injury or an illness, reach out to Retainworks, because you don't know what we can offer. And we can offer quite a bit of things. And this may run into a mental health piece with it. Yeah, I've been toughing it out, but I can't do it anymore. Well, guess what? That becomes a mental health situation.
Yeah, and we've talked a lot about the importance of mental health and how everything mental health is part of public health. They all tie together.
Right.
If you're living under that extreme anxiety and you have those pressures, it's only a matter of time until that pressure cooker overflows. And like anything else from the website that you see that catches your eye.
I think we've talked about a good portion of it. I like this breaks it up into 3 different cohorts, maybe why you might be interested in this as an employer, as a medical provider, and then also just as an individual who maybe needs service. So it looks pretty intuitive, and looks like there are a lot of different offerings throughout the state. But one thing that I'm noticing is it does talk about this being very collaborative and very individualized. So I think that aligns well with what we do in public health here.
So have the employers and the providers and everybody, have they been willing? Have they been easy to work with? Are
Yeah.
you still looking, to bring more in? Or
We're always looking to have referrals for individuals, but everybody that we have talked to about it has been so open about, oh wow, oh I didn't know. And I come at this from a human resources perspective, and many times I've gone in to talk with an HR person, and we're talking about it, and we're running through different scenarios, and they're like, and they kind of get that look, and then they get up and they close the door. I just had somebody call me yesterday, and they're going to be out for 6 weeks. Would they be a good candidate for this? I've got another guy on the floor that's going through some stuff mental health wise. I have some, you get that. It's that light bulb of, oh, wow.
that epiphany?
This is something. And from a business standpoint, just to kind of give you an idea, on the job injuries, so National Safety Council comes out every year with figures. So on the job injuries caused 103 million missed work days in 2023.
That's just for injuries.
That's for injuries at work. Off the job injuries, 540 million work days missed because of off the job injuries. So you're 4 times more apt to get hurt going to the grocery store or skateboarding down 9th Street. Your economic costs $176 billion for on the job injuries versus $1.3 trillion.
Goodness.
Goodness.
Those are staggering numbers.
It's insane. And I worked for a light manufacturer, and their thing was always, their kind of safety theme was always aware, and it was not necessarily just being aware at work, but being aware at home, because they could see that kind of numbers. And I've had a slide in my usual presentation. I've had 3 different slides, and it just continues to go up.
It's amazing. So you mentioned the 2 categories. You said medical and manufacturing. Is that right?
Yep. Yeah, medical.
No, those are two big groups, but
and to me, again, coming from light manufacturing, I was looking at. I came in and I thought, okay, this is probably going to be mostly manufacturing, because I've seen it. I've been inside. I've seen I've been on the factory floors and I've seen it. But it was medical was higher. And I was like, oh, I didn't really think that. And then it's like, okay, that's kind of when we started to look at, okay, not only are these hospitals and medical providers, but they're also employers. So we've talked to them to kind of get them. The state of Kansas, every single work comp or FMLA package, Retainworks information goes out with it. Yep.
That's good.
Same thing for Workforce Alliance of South Central Kansas. If we have an individual that is going out on a short-term or a long-term medical, hey, here's some information on it. If you've got questions, call John.
Yeah. The question I kind of led with when we were talking before we were on the air, I asked about sustainability of the program and how it's funded and all of that. I take it originally Department of Labor was involved.
Yes.
Okay.
Yeah.
So I know that these things they have a sunset date where they run out of funding, and with changes in administrations and what have you, I don't know that this has been picked back up again. But is there a way that you see going forward that it may be able to be continued in some shape or form within the region or within the state? What's the state of Kansas saying as far as this goes? Our Division of Labor.
So our Division of Labor is working with Department of. Actually, most of all of our stuff is coming through Department of Commerce.
Really?
So the department. This grant is from Department of Commerce down through the local workforce areas.
Okay.
And we are working right now on how do we sustain this? How do we continue to provide services? And how do we continue to help the citizens of Kansas? How do we continue to do that? So we're actively working on that right now.
You mentioned earlier too that you said the P word, and that was politicians. Do they seem to push back on this, or are they generally supportive? What's been your...
The individuals that I've talked to have been generally supportive of it. They are like, this is a really good program, and this can really do a lot of good.
Yeah. I'm just kind of curious as to, I hate to think about what goes on in Topeka as far as allocating funding and all of that and budgets and all that. But you would think that for all the things that we as individuals are relied upon by our government to provide, like money, that hopefully they could find a way that when we have needs such as this to help retain that workforce, because I know it's going to be something that's if you don't have it in the future, good gracious, just think of it.
Yeah.
the costs you already talked about. Allie.
Right. I wonder if there's anything that you can look to from the pandemic for the number of people who were home without work or either working from home and how that impacted their health, if that could be supportive to this mission.
Yeah. And this actually started right before
Hallelujah.
right before the pandemic. So, and it came in at really just the right time. And for individuals that are looking for employment, I mean, we've assisted individuals all over the state. Locally, we've had the individual I was telling you about that was working in a warehouse facility and got into a call center position, making $7.50 more an hour than they were. So they were able to bring her on, get them employed in a job that they could do pretty much without any restrictions.
Little brochure I'm looking at talks about how this is a team effort, which again, it's that collaborative that we talk about so often in the work that we do, because we can't do it all on our own. We have to have partners, and then we all have to pull the rope the same direction. So we've got the navigators, we've got workforce coordinators, we've got employment coordinators. I guess as we're getting close to the end of our time, what I'm wanting to know is, what kind of message do you want to send to anybody in one of those groups that's saying, hey, this might be something that we're interested in, or I'm interested in, or how do I get involved? Short of putting your contact information out there on the end notes that we do anyway.
You can put my contact information on the end notes. I have no issue with that whatsoever.
Well, that's good, because that's kind of the prerequisite for the podcast.
Yeah.
But we need to make sure people can know how to get in touch with you.
Absolutely. And we are taking referrals up through October 31st of this year. After that, we'll see what happens. So, but like I said, I'm confident that this is going to continue, because this is a great program. And so if individuals are looking at it or know somebody that has had an injury or an illness, go to the website, www.retainworks.org, and fill out the initial intake form, and we'll go from there.
So anybody that's listening, this likely will affect you or somebody you know, or somebody that's close to you in your life now. One more thing just to keep in your toolbox, to know that, hey, there is help out there in the event that you are affected by an injury, an illness, an exacerbation of an existing condition, any of those things that would impact your capacity to work and earn a living. There's help. I think that's the big thing, because a lot of times you get on the end of that rope, you tie a knot, and you just hang on and hope you can make it. So you're not alone. Pick up that phone or go online, hit the website. Anything else that I've missed, guys? Allie, anything?
I don't believe that you've missed anything. I like when we can have people to come on the podcast to talk about something that's a little bit different. But also how we in public health can say, hey, health doesn't end at our clinic doors.
Right.
This is important.
Yeah.
So.
And this is, from that health department standpoint, this is a tool for you guys. You guys are pretty much the first point of contact. Somebody comes in, they're like, oh yeah, I need this. And you're like, what happened to you?
Sure. I mean, yeah, you
it
never
happens
know. You
that
never
way
know.
sometimes.
Never know where they're going to enter the system at.
Or you might have a community health worker that's out doing community health worker stuff, and they run across somebody and they're like, somebody's in a sling. Hey, you got a good story for that?
I don't think I don't think this type of situation is selective.
No.
It's going to get you no matter who you are or where you're at.
Yep.
So it's not depending upon your age, your education, the color of your skin, any of that stuff.
Yeah.
It's if you're alive, something is going to happen to you. That's the way it normally works, right? So, John, do you have anything else? Any pearls of wisdom or great little things that you want to put out there that we haven't talked about?
I think we're good.
Good, man. Well, I appreciate it again so very much for you taking time to come down, visit with us, get on the podcast.
Yeah, thank you guys.
Yeah, it's great, and the whole idea behind what we do is what we say is we work hard every day to keep to help people stay well, and this kind of fits right into that mantra. So, Allie, anything else you want to ask?
Not today.
Great. Then we appreciate it again so very, very much. Thank you, John, and thank you for everybody that's taken a few more minutes out of your day to listen to us chat and find out about Retainworks in Kansas. And until next time, we hope you all
Stay well.
see you later, folks. Thank you for joining us for this edition of For the Health of It, Cowley County. We hope you found it useful and that you'll tell your friends and give us a listen again during future episodes. As always, we end today's segment by replaying a recent Public Health Minute, which is a weekly radio message focused on keeping you healthy. So, until next time, stay well, everyone. It's the start of another school year, an exciting time for parents and kids alike. However, this time of year can also present its fair share of hazards for children, especially on their way to and from school. So, when your morning or afternoon commute takes you through a school zone, make sure you do your part to make it safer for kids. First of all, don't drive distracted. Put your phone away and keep your eyes on the road. Be especially watchful when you're near schools, buses, sidewalks, and crosswalks. Second, remember that kids can be unpredictable, so always be ready to hit the brakes. Next, keep your eyes open for any crossing guards and buses, and make sure you always obey their signals. And finally, if you spot a bus loading or unloading children, stop and keep your distance so that the kids can safely enter or exit the vehicle. Be extra cautious in your daily commute. It can make the school day a lot safer for the children in our community. Watching out for your kids when they head back to school. It's just one more way the health department works hard every day to help you stay well.